Just what is a cardiac catheterization?
A cardiac catheterization also goes by the name angiogram. Cardiac catheterization or angiogram are basically synonymous. And the reason why a person would go for an angiogram is to see if there are any blockages in the coronary arteries, to see how the heart is pumping, and to see what the heart valves look like. You would go for that procedure if you had clinical symptoms that were consistent with one of those problems, or if you went for a stress test or an echocardiogram, which suggested you had a problem as well. The patient comes to the hospital in the morning. They're given some medications orally to help them relax, and it should be a painless procedure. The actual angiogram portion takes approximately 15 minutes. Typically, we go into the femoral artery, which is in the groin area, and it's a large vessel. We give the person some local anesthetic, and we put a tube into the femoral artery called the catheter. It actually looks like a straw. It's the length of a straw and the width of a straw. And once that tube is in the femoral artery, all the other devices we put into the patient go through that tube, and the person actually doesn't feel anything when it's inside the body. Once we're inside the heart with catheters, which are longer tubes that we pass up through the groin area, we inject a contrast material called a dye. And that takes a picture of the three main coronary arteries and all their branches, as well as the heart function and the valve function. First, we passed a wire across that blockage, and over that wire we threaded a stent. A stent is a device that's made out of metal, and it looks like a spring on a pen. And we introduce it into the blocked artery using dye to position it correctly, and then inflate it. Because it's mounted on a balloon, we use a balloon to inflate the stent into the wall of the artery and open up the artery.